Well, welcome to this UK drug testing product demonstration for the UK2 and K3 25 nanogram urine drug test strip for detecting synthetic cannabis, often sold as K2 or synthetic cannabis, really. Test strip comes in its own individual foil wrapping. The test strip out of the packet looks like this. It has K2 coding on the handle end, which is this end. Central flat section where the results are shown, and we'll demonstrate this for you. To run a test, you just collect a fresh urine sample. This is a simulated sample, and dip the test strip in the sample up to about halfway up the wavy lines. No need to dip it any deeper than that. Leave it in the sample for around 5 to 10 seconds and you will see the wicking starting to affect. You can see that pink dye starting to carry up. Just knock any excess off and then lay it flat on a dry non-absorbent surface, and the best thing to use is the test foil. So we'll just put that down and you read this at between 5 and 10 minutes. So what I'm going to do is pause the video now and talk you through the results for this particular test strip and how to interpret them. Well, we're starting to refilm now at just 3 minutes after we dip this test as an indicator to you that in a negative test you can read these really quite quickly. They are quite rapidly developing, and you can see a nice negative result here with 2 lines showing in the test area. Still note that there's some pink dye, residual dye still on the background. This will clear by 10 minutes and you should have a perfectly white background, but what won't clear is the test line that's formed. Once that's there, it's fixed and it will show for the full 10 minutes of read time. A negative result is nice and easy and can be read very early. But if you haven't got 2 lines and you've just got the control line at the upper end of this test strip near the handle that you've dipped or held to dip the test strip, then you must allow a full 10 minutes development time for a test line to show. And a test line must be interpreted as a test line even if it is very thin and faint. As long as there's a control line there, even if it's not as thick or strong as the control line, if there's any T line showing at 10 minutes, you should interpret that as a negative result. If there is absolutely no line in the T area and a control line, that is a positive result, and it should be confirmed using a laboratory or an accredited method to show exactly what has caused that positive reaction for ketamine. Sorry, synthetic cannabis. This is the K2 test strip we're demonstrating for you. So nice and easy, very quick, rapidly responding, giving clear negative and positive results, very easy to interpret, and available from the UK Drug Testing and Drug Testing Kit websites. If you follow the link below, it will take you directly through to these test kits that are available singly. 5s, 10s, 20s and boxes of 50 of these are available from our website on the link below. Thanks for watching.